From Penn State Health, this is Ask Us Anything About Emergency Medical Services. I'm Scott Gilbert. There are steps everyone can do to help EMS crews do their life-saving job. This involves clearing the way when emergency vehicles are approaching and making it easier for them to find your home. As September is National Preparedness Month, we thought it was a good time to check in with Scott Beakley. He's Program Manager for Penn State Health Lifeline EMS, and he's here to answer some of my questions and your questions today. Just add them to the comment field here below this post, and we'll be sure to pose them to Scott. Hey, Scott, first of all, thanks a lot for being here.
My pleasure.
I'd like to ask you a bit about, it's a bit of a traffic question, I guess.
Sure.
If I'm driving down the highway or maybe in a city and I see an ambulance coming up behind me, what are the steps I should take? How can I be safe as a driver but also make way for the ambulance?
Sure. The first thing to do is do not panic. Whether it's a fire truck, an ambulance, a police car, a lot of times people will panic brake right in front of the emergency vehicle. Okay. The other thing is do not directly stop in front of the emergency vehicle, because then what happens is the emergency vehicle has to serpentine around all the other cars that are stopped.
So is the idea to make way, or is it to just stop where and let them go around?
The idea is to yield to the emergency vehicle. If you have room to get off to the right side of the road, pull to the right. That's the law in the Commonwealth. Some people will pull to the left, which again makes it more of a serpentine for the emergency vehicle. If you're driving a big fire truck, that's kind of a problem. So ambulance, police car, fire truck, whatever, just pull to the right, do not panic, and leave as much room as possible. If you're in a situation where you do not have room to pull to the right, try and get over as best you can. A lot of times we see people at intersections where it's a red light and they don't have room to move. So what will happen is people will start to slowly park their cars to make room for the ambulance, or worst case scenario, we have to wait till the light turns green and then proceed through.
Sounds like some common sense pretty much.
Correct, yes.
Good deal. Let's say I'm the person who called 911 and I requested the ambulance. What are some things I can do to help the ambulance find my home? I've heard things like leaving a light on outside, making sure you have a prominently displayed house number. Are those things helpful?
Absolutely. Those are two of the biggest items, is the light on, especially at night. If possible, if somebody can go out and help flag the ambulance down, that would be great. The biggest thing is just numbering on your house or wherever your business, wherever you're living. We run into a lot of complexes, our apartment complexes, townhomes, and so forth, where the numbers are very obscure. They might be hidden by vegetation, or they're just too small to read. So the bigger the number, the better. We have GPS tracking in all the vehicles, so we're pretty precise at finding your home, but no system is absolutely perfect. So I think the large numbers is the biggest help. Lights at night, and again, if somebody can go outside and help flag the ambulance down, that's best.
You're watching Ask Us Anything About Emergency Medical Services from Penn State Health. Thanks for tuning in for this Facebook Live video. I'm Scott Gilbert alongside Scott Beakley. He's Program Manager for Penn State Health Lifeline EMS. And we welcome your questions, whether you're watching this video live or if you're watching it on playback. Just add them as comments in the comment field below this Facebook post, and we'll make sure we track down some answers for you. You know, Scott, once the EMS crew arrives at the home, what are some tips there for kind of helping them do their job? For example, if I have pets, I imagine that could be a factor.
Absolutely. Pets have a tendency to be a problem for EMS crews when they come to a house. A lot of people think that the bigger pets, big dogs, are more ferocious. That can be. In our experiences, my own personally as well, I think the little dogs are more ferocious.
Is that right?
Absolutely, yes. They are very fierce sometimes. But the thing is, we don't want to hurt the pets. So with the smaller animals, we don't want to step on them. We're bringing equipment in with us, so we don't want to have the smaller animals get injured. The bigger animals, they have animals are smart. They know when someone is sick. So sometimes they will park themselves beside the patient, and they don't really want to move. So if you can take your pets and put them in another room, outside in the backyard or wherever, so they're not in the way, that's the biggest help. The next thing to do is make sure we have room to get into a patient. Sometimes that might require moving some furniture. EMS crews sometimes will move furniture to make way for the ambulance cot to come inside, and so we can extricate the patient. Sometimes we will also call the fire department to come out and help us with extrication of a patient out of a building, whether it be moving furniture or just helping to carry the patient. Again, so that's more importance to make room and get your animals out of the way.
Often when we go to the doctor's office, we're told to have medications ready to show to the doctor. And when there's an ambulance coming to your house, same advice applies, right?
Absolutely, yes. It is. Part of this job sometimes is playing detective. We have people who will go for a 911 call, and we will get handed a several bottles of medication, and we have to take the time to write those down to take that list along to the hospital with us. We really don't want to take the medications to the hospital just for fear they might get lost or separated from the patient. There's a lot of money in those pharmaceuticals, so we don't want them to get lost. So our recommendation is everybody, regardless if you take one medication or if you take 100 medications, should have a list written down of what you take, how often you take it, what the dosage is, and who the physician is who prescribed it. A lot of times people have several physicians who prescribe different medications. So again, that makes our jobs easier, and also the nurses and doctors here at the emergency department and also throughout the health system as they're trying to piece together what might be wrong with the patient, what the reason is for a certain medication, and who prescribed it.
Let's talk a little bit about the different types of ambulance crews that could show up at a home based on the type of call. We hear about BLS, basic life support, ALS for advanced life support. This type of vehicle here is?
This is technically a mobile intensive care unit. It can do the duties of a basic life support unit as well. To qualify as an ALS unit, you have a paramedic on board and you have advanced life support equipment. All of our ambulances are dual role, and the difference between the two is a basic life support ambulance is staffed by 2 emergency medical technicians. They have an AED, an automated external defibrillator. They do not have a medication bag that would come with a paramedic. The difference is in the skill set of the providers between an EMT and a paramedic. So the paramedics would have the heart monitor, they would be doing the IVs, they would be doing the advanced airway skills, carrying more medications. So that's pretty much the difference between the two.
So a cardiac arrest or a life-threatening situation would call for ALS.
Correct. Now, in some situations, you may get both units depending on how a municipality is structured. For most of the areas that Lifeline EMS serves as a 911 coverage, we provide sole service, whereas one of our ALS units will respond. There are some other areas where we work with neighboring BLS units. So this ambulance would bring the paramedic and the equipment, or one of our ALS squads would come with the paramedic and equipment, and then they would jump on that BLS unit and take the patient to the hospital.
Now, you did touch on briefly the difference between EMTs and paramedics. Can you explain that in a little more depth, just so people may hear the terms and think that they're interchangeable, but that's actually not the case?
Sure. The difference is basically skill set and education. Both of them are certified through the Commonwealth of Pennsylvania. An emergency medical technician goes to school for roughly about 3 months. They have a certain skill set. There's also...
Do you hear something, or is it just me?
I think it's our big cousins down the hall coming to visit us. So.
Yeah, so what you're hearing right now is a Lifeline critical care helicopter. It's literally landing right behind us, and I hope you can still hear us, but it's landing right behind us at the landing pad, which is just outside the emergency department here at the medical center. So that's what you're hearing right now is one of our Lifeline helicopters landing, an air ambulance, if you will. And I think that sound will be subsiding here very shortly. But so an interesting distinction there between EMTs and paramedics. I know they have both of those on board the helicopter too, and it's an interesting distinction.
So the EMTs and the paramedics, again, the difference is the EMTs, basic life support. There's also a new certification in the Commonwealth of Pennsylvania called Advanced EMT. It's kind of a bridge between the EMT and the paramedic level. A paramedic program, paramedics will go to school for roughly about 1.5 to 2 years. It's pretty much an associate's degree level program. It has more clinical time involved. They get into more of cardiology interpretation, advanced airway skills, medication, and then furthermore is the critical care transport mode, i.e. the helicopter which just landed. Our critical care transport team is staffed with paramedics and also critical care nurses. And obviously the nurse goes to school for their amount of time, so many years, they get their nursing degree. Also, to work on a critical care team, they have to have a certain amount of years experience in an ICU or in the emergency department at doing nursing level care to get to that transport team level.
A lot of different levels of care available, each catered to whatever the call in particular is all about. Makes good sense. Like I was saying earlier, we welcome your questions for Scott Beakley. He's Program Manager of Penn State Health Lifeline EMS, and we do have a comment here from Tim. He says, "Thank you, Penn State EMS. I have intractable epilepsy, and I'm blind. I appreciate your videos. I have a medical alert bracelet and a vagus nerve stimulator card." Well, thank you, Tim. Thanks a lot for your comment. We appreciate you tuning in for this video. We appreciate everybody's comments and questions. Feel free to leave those in the comment field, again, below this video. can we talk a bit about skills people might be able to learn at home so that they can help a friend or a family member until help arrives? I'm thinking of things like CPR.
Absolutely. CPR, we recommend everybody can do CPR from pretty much any age group at this point. Children, not really little kids, but I know of some kids in the 8-year-old range who have learned CPR and done it successfully. We recommend that for everybody. In addition to the CPR is basic first aid. How to control bleeding, sudden bleeding or severe bleeding, which will help save a life till EMS gets there.
Okay, a lot of important skills there. And where can people learn those types of skills? I guess they can probably contact, even I know the medical center offers classes and that type of thing from time to time, but any advice for people on that?
Yeah, absolutely. You can pretty much find community CPR classes at various locations. Local fire department, EMS services offer them. We offer them through our Resuscitation Sciences Institute here at the Penn State Hershey Medical Center. Also, sometimes municipalities will offer those as community courses. And the other thing, too, is reach out to local community colleges. Here in the Harrisburg area, we have Harrisburg Area Community College, for example. They offer community CPR courses as well. Contact the Red Cross, the American Heart Association. They can put you in touch with local CPR classes that are being held.
Especially important to know those skills, perhaps, if somebody in your home has special medical needs. And I'm wondering also, is it important to register or to at least notify crews in advance before a call happens, just to let them know that somebody has special needs, perhaps that they are on oxygen or have some sort of medical condition, again, prior to any call taking place, just as an FYI?
That is good information to have. A lot of times, and that's something that used to be very, very prominent a long time ago before the majority of the state went to an advanced 911 system. I'll talk about that in a second. If you have a medical condition, it is not a bad idea to give that information to your local EMS provider. The challenge, though, is if your local EMS service is tied up on another call, the 911 center will dispatch the next neighboring appropriate unit to your call. The 911 centers are very skilled at asking information when a call comes in, so they'll be quick to get that information. The other thing, too, is that a lot of people, talking about the 911 system, a lot of people think that when they call 911, there's a delay because the 911 operator is on the phone with them for a certain amount of time. They are as they're asking information, they're typing it into the computer and they're sending it down the line to another dispatcher who's actually talking to the ambulance, police car, fire truck that's coming to your house.
Okay, so that dispatch happens immediately, even as they're gathering additional information.
Correct.
And when it comes to that 911 call, any other advice for people to keep in mind when they're calling 911, some mistakes maybe people make? I know one is sometimes people hang up too soon.
Absolutely. Pretty much in the area serviced by Lifeline EMS and throughout all of central Pennsylvania, it's an advanced 911 system. So as soon as they pick up the phone, they pretty much can see who the caller is and their information. There's still some cellular phone limitations out there that's being worked through. It's a lot better than what it was. But we do run into people who, in a panic, they will call and say, "Hey, I need an ambulance," and they hang up. And then the 911 dispatcher has to call back and figure out what the information or what specifically is wrong to send the most appropriate ambulance. So the big thing is to stay calm, have patience with them, and again, the dispatcher is going to ask you several questions. They're going to triage the call. They're going to send the most appropriate unit and make sure that they have the right address.
You're watching Ask Us Anything About Emergency Medical Services from Penn State Health. I'm Scott Gilbert alongside Scott Beakley. He's Program Manager for Penn State Health Lifeline EMS, and he's here to answer your questions as well as mine, so feel free to leave those questions in the comment field below this Facebook post. Even if you're watching it after it's live, if you're watching it on playback, we can still track down some answers for you. We mentioned earlier, Scott, that September is National Preparedness Month, and I don't want to let you go without the opportunity for you to share some tips on how people can be prepared. I do know that at PennStateHealthNews.org, our online newsroom, the Medical Minute from last week shares some important information, including some quotes from Scott Beakley, and we'll make sure we share that quote with you, or the link to that rather, in this Facebook post. But in addition to that, any other important tips for preparation, especially as we see some of these disasters happening, like floods and hurricanes in other parts of the country?
The big thing is to have a plan, prepare early. And the one thing that we try to tell people too is, in today's day and age, I think people need to be self-sufficient for 48 to 72 hours. The biggest thing is people don't plan for a disaster. Simple stuff like food and water, batteries for flashlights. Everybody has a cell phone, but what happens if the power's out for 3 days and now your cell phone battery dies? So have a way to recharge your cell phone. The other thing too is know your evacuation routes. Know if you have to leave your home suddenly or your office, where are you going? Where would you go to? And then once you have that plan, communicate that with your loved ones and your family. One of the other challenges in a disaster is reunification. Families get split up, and then obviously the communication systems are either stretched thin or damaged to the point that there's no communications. Now families have a very difficult time reuniting with each other. The biggest piece of advice we give people in disaster situation is use your head and don't make a simple problem a big problem. I use flash flooding for as an example. A lot of people think that if there's a flooded road, they can drive right through it. And that's a simple solution of just turn around and go the other way. But what happens is they drive out in the middle. Now the water is up to their windshield, and fire department, EMS have to come, and we have to rescue them. Now you're putting yourself at risk, obviously, but also the rescuers are at risk as well. With the situations we see down in Texas and down in Florida, people have to understand too that the first responder system is designed to handle a set number of emergencies in any given community on an average day. All right, so there's not an ambulance or a fire truck or police car for every single citizen should they need it all at once. So that's where we see challenges in a situation like down in Florida and Texas, where not everybody had, there were people who were waiting for a while for ambulances and help to get there because the emergency responder system is so stretched thin that we were backlogged in calls, and it takes hours and sometimes days to get to them. So that's where the self-sufficiency comes in, and be prepared for those emergencies. If you have to relocate, we go back to the medications. Have your medical history with you, your medications and so forth all written down. So if you have to go to a shelter, somebody there can help you get the medications you need and help you with any type of medical care that you might need long term.
It's all very good advice, especially because we're no strangers to flooding, flash flooding, some winter storms. So as we head into the winter, I know it's in the 80s this week, but soon it's going to be snowing, believe it or not. And so it's always good to be mindful of those tips.
It's hot out here today, but it'll be cold in 2 weeks probably.
So we won't be sweating like this in 2 weeks, right? Exactly. And like I mentioned, we have a medical minute at PennStateHealthNews.org from just last week. So make sure you go online and check that out for additional tips on how to prepare for an emergency, including how to compile an emergency kit that you can keep in your home or car. Scott Beakley, he is program manager for Penn State Lifeline EMS. Thanks so much for your time today,
Absolutely,
Scott.
My pleasure.
Really appreciate the information. And again, feel free to post your questions if you have some that we didn't answer. And thank you very much for watching Ask Us Anything About Emergency Medical Services from Penn State Health.